Williamson County is confirming its first case of the Zika virus.
Health officials say it was travel related, just like the previous 2 cases confirmed in Travis County. The state health department is in the process of getting set up to test mosquitoes for the virus.
And KXAN's Aaron Cargile has learned more about when that testing will start and where.
With mosquito season ramping up, concerns over Zika are creeping back into the conversation.
If I were a young woman, I'd be scared to death.
Gail and David Glass travel internationally and try to stay up to speed on the virus that can cause birth defects for those expecting.
Most of my daughter's friends are in their 30s, and they've stopped taking vacations to even Florida.
Tuesday, blood work tested positive for another Central Texan.
This individual traveled to a Zika-affected area, was not there very long, came back to their home in Williamson County, and then became ill with symptoms that certainly were suspicious for Zika.
To understand your risk, it helps to understand all the steps that have to happen for Zika to spread. First, someone has to get infected in another country, then travel back here to the U.S., and then a mosquito has to bite them. So far, no one with Zika here in Central Texas got it from a mosquito.
It's getting close to 500 cases that have been identified in the continental United States. None of them have been locally transmitted.
That's why local physicians have been focusing more on people than mosquitoes.
It's more likely we will detect it in human case first. And so we're monitoring, we're working with area physicians, we've been working with them on getting people tested.
He says the rest of us should be working on keeping the mosquitoes away.
I have yet to see a mosquito.
Yeah.
Thank goodness. I mean, I bought my off, but I haven't seen one yet.
Come to my house, come to my house.
In Central Austin, Aaron Cargile, KXAN News.
The state health department does not have a date set for when they will start lab testing mosquitoes for Zika. There has to be a concern of someone getting the disease from an infected mosquito, which has not happened here. They may also choose to test in areas that are at higher risk for Zika, such as along the Mexican border or the Texas Gulf Coast.